Hello, everyone. This is the article I chose for my rapid fire presentation. First, straight leg raise test is commonly used physical test on patients with sciatica, which is high in sensitivity and low in specificity. Because sciatica has various causes such as dyscardia, neurocompression, it is hard for clinicians to find specific causes or accurate result with single leg raise test. So in this study, they use extended single leg raise test, which is adding structural differentiations to single leg raise test. The purpose is not clearly mentioned, but they said that we tested ESLR's inter-rater reliability to ascertain if hip internal rotation and ankle dorsiflexion would produce consistent responses in patients with low back pain with and without sciatica. The total number of patient participants were 40, and they were classified into two groups by study controller based on medical history and clinical findings. In sciatica groups, they had signs of sciatica, and in control groups, they had no signs of sciatica. There were also two examiners, examiner 1 and 2, and they produced single leg raise and ESLR tests in all patients, while they were blinding from each other's results. As a test procedure, first they produced single leg raise test, and if the test result was positive, they conducted ESLR test both with hip internal rotation and ankle dorsiflexion. And if the test result was negative, they also did ESLR test, but on the randomly assigned rim. So if SLR test was negative means which is no pain below and at 70-degree hip flexion, and if SLR test was positive, which means there was radiating pain along the course of the sciatic nerve between 30 to 70 hip flexion. In ESLR test with hip internal rotation, you can add tensions to lumbosacral nerve roots, and with ankle dorsiflexion, you can add tensions to sciatic nerve. As a procedure for ESLR, while keeping the hip flexion position from single leg raise test, you will add distal nerve move with ankle dorsiflexion, and you can cause proximal reproduction of pain around gluteal and hamstring areas. Or by adding proximal nerve movement with hip internal rotation, you could cause distal reproduction of pain below the knee. So statistical analysis, they use kappa value and compare between study controller, examiner 1 and examiner 2. As a result, inter-rater agreement between examiner 1 and 2 for ESLA was 0.85, which is almost perfect agreement. And overall agreement between SC, examiner 1 and examiner 2 were also close to perfect. So, however, overall agreement rate between SLR and ESLR was 75%. And in both in examiner 1 and examiner 2, kappa value between SLR and ESLR was 0.50 and 0.54, which is really low. So as a discussion, inter-rater agreement rate was almost perfect between examiner 1 and examiner 2 in ESLR, which was low between SLR and ESLR, which means ESLR might be more accurate than single leg raise test in finding sciatica with different causes. However, there was weakness in this study, which is there was no comparison in single leg raise test, and the number of examiners was also limited. So further studies are required. As a conclusion and clinical application, first, ESLR apply more attention to neural tissues than the single leg raise test by adding hip internal rotation or ankle dorsiflexion. And second, ESLR test produces constant result in patients with low back pain with or without sciatica, which means application of ESLR test might obtain more accurate and consistent test result with patients than single leg raise test. This is the reference. Thank you so much.